Okay, so check it out. Quick update on the double jaw advancement recovery. I am now about 13 months out, and about 7-8 months from my nasal reconstructive surgery. I think I've showed you a couple times that this cartilage that's from my rib has pulled away. My nose is crooked and my septum has been deviated a bit as the cartilage kind of shifted and took hold inside of my nose. So I've got a pretty significant obstruction on my left side, and went back to the plastic surgeon on Monday. And I'm going to be going in on Thursday this week to have another septal repair. He's going to do some rhinoplasty as well. He's going to fix the cartilage in my nose. He's going to take some fascia, probably from my hairline, to wrap around the cartilage to keep it in place so it doesn't bow and it doesn't shrink and it doesn't recess or whatever it does. Hopefully he doesn't have to take any more cartilage. I've asked him not to use my rib only because of the cutting through my abdomen wall last time. He could go to the same donor site, but I just think, man, that would suck. So we'll see what happens there, but he could, if he has to, go behind my ear. I'm going to talk to him again about it one more time because I'm hopeful that he can use what's already in there. He did say he had to thin it out in some areas and move it in some areas. He likes the thickness, he likes some of the things about the first surgery, but he's going to make some adjustments, some revisions to the work he's already done. Hopefully with the same materials that are in my face already from the previous surgery. The upper lip thing, not being able to see my teeth anymore, is really, I guess, the remodeling of my jaw and pulling my jaw forward, and it put my teeth up as well, and created less space for my teeth. So that is not a function necessarily of the nose, which I thought it was, which means that if I ever want to get that fixed, that would be more of a cosmetic thing, which would absolutely suck. So, not out of the woods yet by any stretch of the imagination. It is outpatient this time, thank freaking God. But he said expect about a 3-hour procedure. So, I'm going in Thursday for yet another surgery. So that would be septoplasty and turbinate reduction in the time frame of 2015, double jaw advancement with complication that resulted in then a nasal reconstruction. So that'd be 3. Now this would be the 4th time my nose has been operated on since 2015. Let's hope that I can breathe out of it when we're all done, and let's hope that I look as close back to normal as possible. And I will keep you posted on what happens there. See ya. Wish me luck. Peace. And here we are. Today is April 27th. It's 13 months from my double jaw advancement surgery. About 7 months from my nasal reconstructive surgery, and 1 day following my revision surgery, rhinoplasty, for the resultant complications that were from my double jaw advancement surgery extubation that resulted in a septal collapse and nasal deformity. I had a reconstructive nose surgery with a rib graft in September, which was a very extensive surgery. They had to rebuild basically the inside of my nose, crack some bone, take cartilage out of my rib area, and rebuild my nose from the inside. And so yesterday I had a surgery where, because of the amount of scarring that had happened, my nose had a bulbous appearance and the cartilage from the rib started pulling away from my face. So I don't know if you can see it, but I have a nice incision about this long here where they removed, I don't know if you can see it, they removed some fascia from my scalp to wrap the cartilage. So they basically took the cartilage out, reshaped it, wrapped it, shaved my nose down. And so to remove some of the scarring in there and open the airway a bit. So my airway's open. It's not packed right now, which is good. But my airway's open, and they really did a lot of reshaping because it pulled away. I still had a little bit of a slope and not a straight. It kind of like, I don't know. You can see in my other videos, the video that I took the day before this, probably the day before the surgery, will show just how different my nose looked. So now I have a splint, got some stitches under my nose, and I go back on Monday to, I think, get the splint removed. We're going to do much more aggressive massage, I believe, and manipulation right after the surgery this time around to see if that improves the shape. So it was a medically necessary procedure again because of the blockage. It actually deviated to the left again. And so we straightened that. It was all straightened out on the inside. But it was really a very kind of cosmetic in nature, I believe, because of... oh, look at that. I'm bleeding. Cosmetic in nature because of the amount of swelling and scar tissue buildup. So hopefully it's my last fucking surgery for this whole thing. I'm 30 days now, no fitness or exercise, nothing that can raise my blood pressure because of the, chance to bleed or what have you, and increase the size of the scar. So I feel much better today after this surgery than I did after the last one, because the last one, the rib graft, was so painful. And they broke my nose, and so I got all swollen and black and blue. I don't expect to have black eyes, which is good. But again, it's another surgery. Now 13 months out from my original jaw surgery, and persisting issues with my sinuses and my airway and my nose now that were from the extubation. But hopefully I'm getting to the end of the road here, and we'll just be on to a recovery path and go back to a normal life with hopefully a more normal looking appearance. It's amazing when you see people that you haven't seen in a while, when they tell you, not to you, but they tell other people how different you look, and you don't realize it because you're used to seeing yourself every day. But when I look at pictures, holy shit, my appearance changed drastically and dramatically. And so hopefully now I'll be back to close to what I looked like before. So hopefully that is an improvement. So anyway, that's the update for 13 months post double jaw advancement surgery, 1 day past rhinoplasty revision surgery, 7 months past nasal reconstructive surgery. Peace and adios, and thanks for tuning in.